Well, good morning, everybody. Buenos dias. My name is Dr. Alice Ann Bones, and I have the pleasure of introducing our next set of speakers. For our next session, we have three great panelists. First, registered dietitian and home to feeding expert and educator, Cynthia Reddick. Second, we have Executive Director of the Global Enteral Device Supplier Association, or GETSA, Mr. Ben Davis. And finally, inventor and medical innovator from LumaClean, Mr. Martin Von Dyke. Welcome all. The floor is yours.
Thank you very much, Alice. Well, our presentation today is enteral medication administration, recent findings, best practices, and resources. And our main goal following that title is to promote safe enteral medication administration by preventing tubing misconnections, but it's also to improve access to key items and promote safe practices. We're going to do this in a couple of sections today. We're going to start with a brief intro just to give you the real high-level view of what a tubing misconnection is, and in case you're unaware. Then we'll have a first part of our presentation is to cover some recent findings and ways to improve patient access to medication administration items. Part two is enteral medication administration safety, along with some resources that we have available to you. And then we'll hand it off to Martin, who will cover some notes on cleaning from LumaClean from Martin. And then we'll wrap up with the questions there at the end. So, tubing misconnections. What is a tubing misconnection? Well, I like the FDA's definition, which is inappropriate connections occurring between two connections that attach devices with different intended uses or applications, such as feeding systems and non-enteral systems. It's very important to note that tubing misconnections can lead to serious injury or death. For a little bit more background, I would encourage you to visit this website here in the bottom right link. The FDA has put together, I want to say it's close to 20 different real world misconnections that have occurred. They've basically recreated in a sim lab. So you can really walk through and see, how this misconnection occurred and basically get the guidance directly from the FDA on these events. Well, how do we solve tubing misconnections? Well, usually we go into quite a bit more detail here on background and how this came about, but essentially, well over a decade ago, the International Organization for Standardization developed the ISO 80369 series of standards. What this does is it provides a mechanically engineered connector for each bodily system so that these systems can then no longer cross-connect to one another. Of course, what we're talking about today is INFIT, which is actually the ISO 80369-3 standard. But as you can see from our diagram, we call this our ISO man. Each body system has its own dedicated ISO standard that goes with it. And these are basically one of the big differences between these and legacy style connectors is that these are semi-rigid, so they're not pliable. You can't force fit a connector or adapter into them that was not meant to connect with them. And that was our sort of high-level background. And with that, I will hand over part one to Cynthia.
Thank you, Ben. Yeah, so just kind of soak in the images here on this slide. I want to introduce you to some of the parts and pieces that are involved in the administration of medication through an enteral feeding tube, because these are the questions we were asking around challenges in getting access to these in the home care space in particular. So you're looking at bottle adapters. These are little parts that go onto medication bottles when it's a liquid medication. It allows you to connect a syringe to draw up medication. And they come with also straws, like medication straws. You may hear some of this terminology. This is something that you can, on the end of a syringe, insert into a bottle of liquid medication and draw up medication for very precise delivery of, in some cases, extremely potent medication. And, administering medication to patients across the age spectrum. And so sometimes they're littles, they're infants, and the doses need to be extremely precise. And sometimes it's a child or an adult, and it's a very strong medication like a narcotic, and every single drop matters. So these are the types of things that, you know, we have to think about when we are promoting safe connection. And with the change in the design, these are parts and pieces that help us administer medication safely. So what we're going to go into next is some background on, we needed to get data. We needed background on, you know, what are the experiences of feeding tube users. And so this survey was developed in collaboration with clinicians as well as the Oli Foundation. The Oli Foundation is a patient advocacy group that serves the tube feeding population as well as the TPN population. But we really wanted to better understand what are the real world challenges. We had heard a lot of anecdotal challenges, and so this was our way of, you know, collecting data around the challenges that the feeding tube users face when they're trying to access the essentials for medication administration. So like the syringes and bottle caps, like I was illustrating to you on the prior slide. So we got data from about 400 patients, caregivers, and what we call consumers. So that's the language we use in the home space. And we, you know, wanted to know, are you administering medication through your feeding tube? Because sometimes feeding tube users still take medication orally, but you know, most patients were receiving those medications through their feeding tube. So we confirmed that information, and the breakdown shows, was it liquid medication? Was it a crushed medication? Was it both liquid and crushed? But nearly 100% of patients were receiving those medications through the feeding tube. So this was really helpful information for us. On the next slide, we'll go deeper into the survey and, you know, are you accessing through an ENFIT connector? So this is something that we're tracking. Ben is tracking vigilantly all the time. How are the conversion rates going across the United States? Because in other parts of the world, it's done. It's a done deal, and we're still sort of moving things forward. So this is a really encouraging number. 83% are using the ENFIT connector. And that is also really helpful information because it's not easy to get to in the home space. So next we wanted to know, what are you using to administer your medications? And so there's all these different medication syringe sizes, and you can see, you know, the 60 ml syringe, over, I think, half of patients were using these 60 ml syringes. But this is not all going to add up to 100% because patients are using and they're receiving multiple sizes of syringes. A 60 ml syringe is a syringe that you get to administer water as well as feeding. And most patients actually use those 60 ml syringes to administer medication as well. But you can see that the 10 to 12 ml size is also a popular size. But we dug a little deeper, you know, why are patients using the larger syringes? Do they need to be using the larger syringes or a 10 or a 12 ml syringes? Like getting a little bit more information around why they're choosing the sizes that they're choosing. So what do you actually need to use to administer your medication? Again, the 60 ml and 10 to 12 ml syringes really led the respondents. And then 50% of feeding tube users chose to administer medications through a 60 ml syringe, even though the dose wasn't necessarily related to that. So that's when we asked, what is the most typical volume that you're actually administering for liquid medication? And you can see that more than half. And you go ahead.
We lose Cynthia's audio, I think, but yeah, I can pick this up. What was interesting is that although 50% of respondents use 60 ml syringes for medication administration, only 16% of the doses even exceed 20 ml. So that was someone that's dealt in dose accuracy quite a bit of their career, it's a kind of alarming that so many people are using 60 ml when the dose volume is so much smaller. I mean, according to this graph, 30% of the doses are less than 6 ml. And then we also want to know how difficult is it to obtain enteral medication syringes. And what we found is that 55% of feeding tube users have a difficult time obtaining medication syringes. So it's not, should not be that way. Previously, in the legacy world, you could walk into a retail pharmacy, and if you got a liquid medication, if it was a decent pharmacy, they would probably give you a oral syringe and even a bottle adapter to go with it. And that's just not as easy as that anymore. Cynthia, are you back? Do you want to pick up? Or
Yeah, keep going though, Ben. You're doing
okay.
great. You really present this material really well, so go for it.
Okay. So same thing with medicine bottle adapters. We want to know, how hard are they to obtain? Our feel was that these are a little bit more difficult because it's just a little bit more of a niche thing. It's not something that's real common like DMEs to carry as opposed to, syringes. And what we found is that 74% of feeding tube users have a difficult time obtaining these medicine bottle adapters. And then we wanted to know kind of combined, how difficult is it to pay for these? So if you're having to pay for enteral medication syringes and bottle adapters, how difficult is that? And what we found is that 75% of feeding tube users do have to pay for their medication syringes and bottle adapters. And of those that do pay, 61% have a difficult time paying for them. So Cynthia gave a little highlight of some of these earlier, but just so you know what we're actually talking about in case you're not connecting the dots, we're talking about like bottle fill caps. That's these purple caps at the top. Medication bottle adapters, or sometimes called press-in bottle adapters. That's what the middle row of adapters here is. Things like straws. There's things like fill cap couplers, bung adapters. Really, all these sort of medication administration accessories that were available in the legacy world are now basically available for infant. It's just there was a knowledge gap that they actually existed. So to help fill that gap, we developed this pharma guide. Now, this is a simplified single-page version of this, but I encourage you to follow the URL here, the link at the bottom. It'll take you to the full-page guide, because one of the knowledge gaps, too, is, well, what are these things even called? And on the full guide, we break these down into each little category specifically, so that if you knew that previously you were using like this blue cap, well, this is called an adapter cap or a pharmacy cap, and in the infill world, it's called a pharmacy fill cap. That you are then able to ask for the item that you seek instead of trying to describe it and play charades and figure it out with your pharmacist. So that guide is there as a resource to help you. And also linked off of that guide is a resource site for consumers where you're able to direct people that can go find, I don't even know how many links it is. It's probably at least 40, maybe even more links where we've been able to find these things online and have them out there as a shared resource, so that instead of having to hunt all over the internet for these things, you can have kind of a one-stop shop where people can easily find the items they're looking for. And also trying to improve this patient access or consumer access, caregiver access to these items. We formed a retail pharmacy committee about a year and a half or so ago. It's made up of clinicians, manufacturers, pharmacists. We meet routinely. We were meeting twice a month. Now it's once a month. And it's all about improving access to these items. As a matter of fact, it was this committee that developed that survey with Oli that we were just sharing the results for. But I feel like we've made a lot of progress with it. We've learned so much about the retail pharmacy space. Frankly, most of GETS's members really deal more in the acute care space. So trying to understand the supply channels and how things work in the retail pharmacy world has been a big learning curve, but I feel like we have learned a lot. And that has transitioned to progress. So I certainly feel like we've made a lot of headway, really thanks to that group and the wonderful people that participate in that committee. CVS now has infant syringes and ball adapters available in multiple states. This is a fairly recent development, probably in the last 2-3 months, and they continue to roll out into more and more pharmacies in more and more states. So they've really been a champion of making this better. Also, Delaware was really ahead of most states in and getting coverage for infant bottle adapters and syringes passed so that their access challenges were alleviated. So kudos to Delaware and especially kudos to CVS. And then that gets us into part two, which is enteral medication administration safety and resources. So as we went through this exercise and learned so much with this committee, we just happened to see a lot of different things because we're plugged into a lot of social media and feeding groups, and just thought we'd share some of these because they are all sort of tied together. You know, if we're addressing access, let's also address safety in the home market. So thought I'd share some interesting things that we discovered and ways that we can probably improve on some of these practices. One, this is a real example we found for about syringe size selection. So this person was trying to understand how to drop a 0.6 ml dose using this 10 ml syringe, and they weren't sure whether they were supposed to draw it up to the 6 or somewhere just past the 1. Where in actuality, no, this is the green mark here is the 0.6 mark. So a lot of folks have trouble understanding how the gradations on the syringe work, and especially when it gets into smaller doses, because again, these seems like the smaller the syringe size, the less common they are. But following the National Council for Prescription Drug Programs, their recommendation, they have this table which we linked here as well. For a dose that's less than 1 ml, you should use a 1 ml syringe. Actually, I asked ISMP if they had guidance or recommendations, and this is what they pointed me to. So this is who, the sort of authority on pharmacy, this is what they follow. So clearly here, this syringe would not be following this best practice or the recommendation. But then to kind of elaborate just a little bit on that, that same dose, here's 3 different syringes that would contain that dose. But if you're following the recommendation, there's really only one choice. It's only that 1 ml. So yes, you could put it in the others, but 2, notice these other syringes, they don't actually have a marking that even says that dose volume. So you really kind of expose the patient or consumer to a misdosing when you're not using the correct syringe size. And not to get too much into the weeds on this, but just for everyone to understand too, as a former syringe manufacturer, I think people have an expectation that the syringe should be accurate, and it should be, but it has limitations. It's not a burette. This thing is not designed, but to be so capable. I mean, it's a disposable, most of the time, single-use medical device. And they're designed to this ISO standard. ISO 7886-1 has what's called tolerance and graduated capacity. Now, this is all kind of complicated, and if you're a syringe manufacturer, this is like your holy grail you have to follow. But what that is, there's formulas in that column basically break down and show you that for certain doses, a syringe only has certain capabilities. So we developed this tool, and you can see here for that 0.6 ml dose, the only syringe acceptable across this array of syringes would be the 1 ml. And in some cases, with a marginal safety factor, you could probably get away with a 2.5 or a 3 ml syringe, but really it's the 1 ml. And keep in mind, just for the next slide I'm about to share, if you look at this, the syringes go up in size from 0.5 ml to 100 ml from left to right, and the dose volume goes up as you progress down this table. This was a huge calculator basically we built, and I hope to continue to work with ISMP or ASHP or some pharmacy related group to further be able to utilize this tool that we built. This thing actually goes down. You can see this. This is best I can do to fit it on one slide, but it's a huge table that kind of gives you the range of where doses are acceptable. So as I said, the doses go up as you progress down the table, and the syringe sizes go up as you go to the right. But 100 ml syringe way out here on the right, obviously you're not going to be dosing like a 1 ml dose out of it. That's why it would be in the red way up here. So we do hope to further sort of develop that and have it out there as a tool that's available. Just another syringe safety issue that did come up in these exercises and activities and learnings that we were having is how to read a syringe. This is another real world example I saw online. I really like this because the draft is just so curious as to what dose is supposed to be. Um, but yeah, this person had asked, where do you read the syringe from? And I can tell you, again, having manufactured syringes for many years, this question would come in all the time. It's and not just from patients, but from clinicians and even from like pharmacy techs that fill syringes all day long. Um, it's a little bit alarming, but the answer to that is we should always look at the manufacturer's instructions for use. However, practically speaking, especially in the home market, we know that's not true. So kind of a quick hack or a trick, I guess you could do that I've learned over the years, and I've never seen this not to be true, is that if you don't have an IFU, instructions for use, you can find the zero mark on a syringe. And then when you push the plunger all the way forward, whatever part of the plunger aligns to that zero mark, that's where you read the syringe from. So here it would be the leading edge of this black gasket. But this, like I said, this little trick kind of works for, I've not seen it not work for a syringe. So just kind of keep this in your back pocket if you're ever unable to locate the IFU. This is a good way to do it. And then one of the last things that we really found helpful for medication administration safety was to have a checklist. This paper came out maybe close to not quite a year ago, I don't think, but what they did is they studied basically the use of having a checklist for enteral medication administration, and the error rates decreased 95% by having a checklist for enteral medication administration. And their actual checklist basically look like this. For the sake of time, we can share this and more about this offline, but it was, it wasn't super complex. But some of the things that are good to have on a checklist is, need to know things like do not crush, or the medication's time released or enteric coated. These things you should consult the pharmacist before crushing these. Another good thing to have on your checklist is before administering medication, you want to flush the tube with 15 mLs of water. Same thing for after administering medication. You want to flush again with water. You should also, another checklist item is to use only metric only measuring devices. If you use teaspoons or have some old syringes that maybe aren't in fit and they still use teaspoons, that's a 5x difference from milliliters to teaspoon. So you could be misdosing someone by 5x if the prescription's in ml and you're dosing with the teaspoon or syringe that has teaspoon markings. And just a few others are do not add medications directly to feeds. Tablets you got to be real careful with, capsules. Really, these are all things, and for the sake of time, I'm not going to read each one individually, but things that you should probably consider or hopefully have a checklist built for medication administration, enteral medication administration. And then we also have a few other resources I'll quickly cover. We have a medication administration guide on our website that really gives a step-by-step sort of best practice for administering enteral medication, preparing and administering enteral medications. And we also have 2 videos specifically to this topic. One's for administration of medication in the home care setting, and then the other is in the inpatient setting. So both of these are out there on our YouTube channel and very helpful. And also Aspen just came up with a video series, a 5-part series where they cover enteral medication administration as well. So I want to be sure everyone is aware of that and encourage you to watch through those videos as well. And with that, I will turn things over to Martin.
Well, thank you. And hello, everyone. I'm Martin Von Dyke, the president of Lil McLean LLC. And we developed the NClean brush, which is basically a cleaning tool to help maintain and clean the NFit connector. I guess we can go to the next slide. I don't know who's control. There we go. Perfect. Thank you. It's basically specifically designed when the NFit connector, which is an amazing safety enhancement in the enteral world. It requires cleaning. Its basic food hygiene practices should always be observed. I know we're speaking with predominantly dietitians. Food hygiene is something that is absolutely essential. And when you look at the design and architecture of most enteral fitments, they have areas where enteral formula, if it's in a NICU, human breast milk, and other proteinaceous and life-supporting fluids can accumulate. So we developed the ENFit cleaning brush specifically, and its only purpose is to safely clean and maintain the ENFit connector. So I know some people might be using toothbrushes, cotton swabs, wipes, cotton balls. Once you see the next few panels, you'll understand why those are absolutely ineffective and can actually result in unintended consequences. So with this slide, we're basically saying, look, it's already published and known that food hygiene with enteral formula is essential. These connectors, like if you say we don't use dirty dishes, well, if you don't clean your ENFit connector or any other connector actually that is attached to an enteral line, you're serving food on dirty dishes. I mean, just to oversimplify it, and that, of course, intuitively, most of us know the consequences and the risks associated with not having good food hygiene practices. So there you go. This is the real important slide that I really wanted to focus on. I only have a minute left, I believe. And that is a cutaway design of the ENFit connector. Again, an amazing safety breakthrough. However, if you look at where the arrows are pointed, these are the internal tortuous pathways that prevent IV connections from being cross-connected. But if you don't clean them appropriately, you will have enteral formula, human breast milk, proteinaceous fluids, and meds accumulate in these three target areas. Probably the most concerning is the bottom one, which is the underside of the internal screw thread, because that's where bacteria is going to really colonize, and we could have unintended consequences if it makes its way back to the feeding lumen. So with this device, the N-Clean brush, again, a cutaway, it shows you that the first thing that it does, you have the occluder. It guides in, it also helps center the cleaning brush, and it occludes the feeding lumen. So as the brush bristles are cleaning the ENFit connector and removing any debris and fluids, etc., encrusted materials, the risk of anything going back into the feeding lumen and contaminating the patient, especially a compromised patient or a neonate, has been greatly reduced. So that's a huge safety feature. It also makes the process of maintaining the ENFit connector fast, because you just have to dip it in whatever cleaning fluid you want to use, saline, mouthwash, water, whatever your protocol uses, you can do it. And again, you see the occluder. I'm rushing, I'm sorry, we're running out of time. But you can see the perpendicular brush bristles, how they engage with all the interior surfaces of an ENFit connector. It's literally touching 100% of the interior surfaces to help remove any debris and bacterium. So if we go to the next one. Okay, there we go. As a benefit, this device was designed to be single patient specific. So in other words, it can be reused up to 30 days with a single patient. So especially an adult patient. In a NICUs, they'll throw it away after one shift. It's inexpensive enough. But the bristles themselves, the nylon bristles themselves, are impregnated with silver ion, colloidal silver, so that if the device is taken out and then stored bedside between the next feeding, no bacteria will be allowed to colonize and grow on the brush bristles themselves, which is a very important feature. So you're not cross-contaminating or recontaminating or re-inoculating a patient with the flora. And so it's designed to make it easy for the practitioner, a dietitian, whether it's a nurse, a patient themselves. We do sell these directly to patients. They love it. Certain hospitals and NICUs carry it. It's available by most dealers out there. So we encourage you to visit our website, learn more about it. But again, basic food hygiene practices should be something that you as dietitians should always be thinking about, in addition to what the previous speaker had mentioned about food kindness. So with that, I will conclude, and if there's any questions, I'd be delighted to answer them.
Thank you so much. This has been wonderful information, a lot of good comments, hearts around. So thank you for all our three presenters. One of our most recent questions ask about, are we able to order this on the intro prescription as part of their supplies?
The unclean brush, yes, they can. It's carried by most of the major dealers, Cardinal, Owens and Minor, Medline. We also sell direct to basic hospital buying groups. So depending on what they're affiliated with, also whether it's individuals, it's available on Amazon, eBay, our website, Etsy. So we make it super easy for people to get access to this device.
Okay, wonderful. Thank you. Another question was, I think Getza will be attending Aspen. Will LumaClean be attending Aspen in February?
We do plan on attending Aspen.
Okay, great. Thank you. Also, information about at college level for nursing or other educators. Um, is there anything available?
Regarding the N-Clean brush or the learning about the NFit Connect?
I believe Getza has some about the N-Clean brush.
And put a link in the chat for you all there's a tremendous amount of video education resources on the GETSA website that goes over everything as to why do we talk about this? What's the background, like way bigger picture of what Ben introduced us with that's really helpful, and then the how to implement in health systems and a lot of best practices. So there's a lot of information at that resource link for you.
Yeah, and I'll
Okay.
just for more background on that, I'll share very quickly the between two literature reviews that have been done, there have been 212 enteral misconnections that have been found in the literature, of which 25 people died. But due to a survey, because we know not everything gets reported into the literature, a large survey was also conducted that found that 50% of clinicians had experienced a tubing connection at their facility. So we know that the occurrence rate is much higher. And then also 80% of the respondents in that survey said that the misconnection was not reported, or they did not know the outcome, like where it was reported or any follow-up on it. So that kind of validates our assumption that these largely go unreported and just don't make it into the literature. But even the ones that are in there, 212 is 212 too many. So, but we have a lot
Okay.
more background on the initiative and the safety aspects there too. We wanted to share a lot of this pharmacy resource, sort of new information today. But yeah, we have a lot more of the background available, and you can also contact us at info@getsa.org, and please visit stayconnected.org, our website.
All right. Well, we are at the top of our time. Cynthia, Ben, Martin, thank you so much.